Can you imagine a powerful new class of medication that could decrease inflammation, relieve the pain, and improve the function of your joints? If you suffer from rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and even alopecia or hair loss, you should watch this video. Why? Because I will discuss a new class of medication called JAK inhibitors. And these are biologics or medications that will come in a form of a pill and not injectables or infusions. I will also explain you the major risk or potential side effects, so stay until the end to learn everything that you need to know before you discuss it with your doctor.
Rheumatologist OnCall.com.
Hi, I'm Dr. Diana Girnita, and in this video I am going to explain to you all that you have to know about a relatively new class of medication called JAK inhibitors. In 2011, the FDA approved the first medication from this class, a drug that was used for a rare form of cancer called myelofibrosis. It took another year, and in 2012, another drug called Xeljanz or Tofacinib was approved. In 2018, Olumniant or Baricitinib was also approved for rheumatoid arthritis, and in 2019, Rinvoq or UPADACITINIB was also approved for rheumatoid arthritis. And in just a few years, after even more research, these drugs were also approved for patients with psoriatic arthritis, ankylosing spondylitis, Crohn's ulcerative colitis, atopic dermatitis, and in 2022, Olumniant or Baricitinib was approved for severe cases of hair loss. If you are interested to learn more about how you can treat hair loss if you suffer from an autoimmune disease, you should watch this video in my channel. How JAK inhibitors work? JAK inhibitors or JAK kinase inhibitors are a type of targeted synthetic drug, meaning that this is a medication produced in a laboratory that will block a family of enzymes called JAK. These enzymes are crucial in sending a signal to the nucleus of certain immune system cells to let them know to produce multiple molecules of inflammation like multiple types of cytokines. By blocking the activity of these enzymes, your immune system cells will stop producing these cytokines, and in this way, it will reduce the inflammation and also the pain, and you will feel better. What JAK inhibitors we use in rheumatology? There are about 10 JAK inhibitors approved on the market, but we only use 3 in rheumatology to use rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. They can also be used in other autoimmune diseases like Crohn's, ulcerative colitis, and even atopic dermatitis. These drugs that we use in rheumatology are Tofacinib or Xeljanz, Baricitinib or Olumniant, and UPADACITINIB or Rinvoq. The big advantage of these drugs is that they come in a form of a pill. Many of them are being administered as one pill per day. And this is very convenient for many of my patients because they are happy to take a pill rather than having an injection every week or every 2 weeks, or even more like having an infusion. Taking one pill per day gives you the freedom to travel easier, to get the medication with you in a bag, not to carry any freezer bags, and not spending 1 day or even more per month to get an infusion, for example, in an infusion center. What are the tests recommended before you start therapy with JAK inhibitors? I always recommend the following tests to my patients. A CBC is to check all the cell counts and make sure that you don't have any low platelets, low white blood cells, or anemia. I do recommend a comprehensive metabolic panel to evaluate the kidneys or the liver function, and I always check my patients for tuberculosis, hepatitis B, and C. What are the major side effects of JAK inhibitors? While JAK inhibitors come with great benefits, they may also pose some serious side effects. The most common side effects are increased risk of serious infections, especially herpes zoster infection that can cause shingles. Shingles is a reactivation of the chickenpox virus when your immune system is too low. That will cause a rash, usually on one side of the body, that can be very painful. To avoid that, I always advise my patients to get vaccinated for shingles before they start therapy with JAK inhibitors to decrease the chance of getting this type of infection reactivated. Another possible infection can be tuberculosis, and that is why I recommend testing before. There are also reports of other infections that you can develop. So if you develop signs of fever, chills, night sweats, cough, rashes, or even diarrhea or vomiting, you should call your doctor immediately. In 10 to 20% of patients, the therapy with JAK inhibitors can also increase your lipids level, like increasing your cholesterol levels. And sometimes this increase in cholesterol is also associated with increased levels of inflammation. If the increase in cholesterol is noted, talk to your doctor if you need to treat that with medication, or you can just manage it with diet. In 2022, another serious side effect was reported where it was an increased risk for cardiovascular events like heart attacks, especially in people that had risk factors for coronary artery disease like high cholesterol, diabetes, obesity. However, in a follow-up analysis, the increased risk of heart disease was primarily in patients with risk factors and was not observed in people that did not have an increased cardiovascular risk. So the dose of Tofacinib, 5 milligrams twice daily, was found to be safe. There are also other studies that did not find a statistical significance in the increased risk for cardiovascular side effects. Like I said, strokes or heart attacks, even all-cause mortality for these drugs. And I will point here the studies where they reported that, like this study from France or another study from Hong Kong. But in the US, the FDA kept this warning as a black box warning. So once again, if you have a prior history of heart disease, heart attack, you should disclose that to your rheumatologist and discuss whether this is appropriate or not for you. Another side effect was an increased risk to develop venous thrombosis, like clots in your veins, like DVT, or clots in your lungs, like pulmonary emboli. But this can be a severe complication, and if you take this drug and you develop sudden acute chest pain or sudden shortness of breath, you should call your doctor and you should go to the emergency room. Accordingly to this study in Sweden from 2023, the risk of developing pulmonary emboli is higher in patients that are taking Tofacinib and Baricitinib. JAK inhibitors may also increase the risk of cancers like non-melanoma skin cancers, lung cancer, and lymphoma, but the studies are still not clear if this is an effect of the drug or this is an effect of ongoing inflammation, which happens in people with rheumatoid arthritis and psoriatic arthritis. But be careful, have frequent checks of your skin, and discuss with your doctor if you have any new symptoms. And that's why I check on my patients every 3 months, and I stay very, very much in close contact with my patients. There are also other side effects reported, such as anemia or low white blood cells. If you develop anemia during the treatment and your hemoglobin drops less than 8 or 9, or if your absolute neutrophil counts drops less than 1,000, or your absolute lymphocyte counts drops less than 500, then the treatment needs to be interrupted, but not without your rheumatologist approval. Some patients might also develop elevated liver enzymes, nausea, and there are just a few reports of gastrointestinal perforation, but they are rare, and that's why if you develop abdominal pain, nausea, vomiting, get in contact with your doctor. There are also some cases of acne, so make sure you pay attention to your skin. And this is just a limited list of side effects, because a full list of side effects, you need to discuss those with your doctor. Now, despite all of these reported side effects, you should not get discouraged. That should not stop you from trying this medication, but rather make you aware and get an informed decision. And if you develop any of these side effects, you should get help right away. JAK inhibitors are great medications, and many of my patients respond very well to them. As I mentioned here, I use this medication for patients with rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and as with any treatment, open communication, close monitoring, and a thorough understanding of the risk, the benefits are essential for you to be safe and to have an effective treatment. If you want to learn more about other treatments for rheumatoid arthritis, you should watch this video on my channel. See you soon.
Rheumatologist OnCall.com